Hello parents, myself Dr. Anupriya. This video is a vaccination guide for your child up to 5 years of age. So let's break it into why should we vaccinate our child? How do these vaccines work? What are the schedules we follow? How do we administer and what to expect after vaccination? How to take care of the baby post-vaccination? What is herd immunity and what is catch-up vaccination? So now why to vaccinate your child? Why is it so important that every doctor asks you to get your child vaccinated? Parents, it's a very old saying that prevention is better than cure. So it'll always be wiser to prevent the disease than to treat it once it occurs. Vaccination is one of the most cost-effective tools to reduce the disease burden. It is safe and effective. Vaccines protect your child and prevents serious, potentially life-threatening diseases in your child, which can cause severe illness and disability, long-term complications, even death. Once you vaccinate your child, the disease severity and complications reduces a lot. Vaccines not only protect the individual child but also the whole community. The individuals who are vulnerable to the disease will also get protected by it. When a high percentage of population is vaccinated, it prevents the spread of contagious diseases. This protects the vulnerable group like the newborns, old age people, or the ones with weakened immune system. Vaccines have dramatically reduced the incidence of childhood diseases which were once very devastating. Now, what are vaccines? Vaccines are weakened or inactive forms of viruses or bacteria or some part of it like its protein, sugar. These forms cannot cause the actual disease in the child, but it'll stimulate the body's immune system to fight against the specific germ. It prepares our body to create antibodies which target and destroys the specific pathogens. Now, how do these vaccines work? So the vaccines which we inject to our babies contains the inactive or the weakened parts of the germs, bacteria, viruses, or its part, which acts as an antigen. So we inject it into the body. The body identifies it as a foreign part and starts producing antibodies against it so that it fights off and destroys it. Now we have something called as immunological memory. So our body remembers this pathogen, this antigen which was given through vaccine. Next time this particular bacteria or virus infects the child, the body will start producing antibodies and destroy it. Now we have different types of vaccines. First is the live vaccine, which contains the weakened form of virus or bacteria. Next is the inactivated one, which contains the killed virus or bacteria. Next is the subunit vaccine, which contains a part of the virus or bacteria. Next is mRNA vaccine, which instructs the cell to make a protein that triggers immune system and hence fights the infection. Now coming to vaccination schedule. There are two schedules which are followed in India. So one is the National Immunization Schedule, which is followed by the government, that contains bare minimum vaccines which every baby should be vaccinated. Second, we have the IAP schedule, that is Indian Academy of Pediatrics. So it contains the bare minimum ones plus the optional vaccines which the government cannot afford to give. So these are the vaccination charts, you can go through it. You can either take all the vaccinations in the private setup or you can take the ones which are available in the government plus the additional ones from the private setup. It's totally your choice. But if you can afford, make sure to vaccinate your child completely. So here you'll be seeing the two different schedules, IAP and NIS. That is Indian Academy of Pediatrics, which we follow in the private, and National Immunization Schedule, which we follow in the government. Nowadays, every new parent is confused whether to give the pain vaccine or the painless one. Let's discuss this. So the painless vaccine doesn't mean that the baby won't realize when the injection is given. The basic difference between the two is one of the components of the vaccine. So at 6 weeks, 10 weeks, 14 weeks, 16 to 18 months, and then 4 to 6 years of life, babies are vaccinated with DPT. So in which the P stands for pertussis. So the pain vaccine contains whole cell pertussis, due to which the baby has fever, swelling, redness and pain at the vaccination site. Whereas the painless vaccine is acellular pertussis. So it doesn't contain that part of the pertussis. Has minimal fever, and pain at the vaccination site. This is the only difference. And the painless vaccine is available only in the private setups. Both have the same efficacy, so you need not worry about the immunity. Next is how are the vaccines given and the post-vaccination care. So the routes of administrations are firstly injectable. So it's most commonly given into the muscle or into the skin. Second is oral, that is given via the mouth. For example, polio vaccine. Thirdly, nasal. It's given as a spray into the nose. For example, flu vaccine. Next, the common side effects. There will be pain, redness, swelling over the vaccination area, fever, fuzziness or irritability, muscle aches. These symptoms usually last for 48 to 72 hours. Newborns may show different behavior after vaccinations. They may cluster feed or not feed for longer stretches. They may sleep a lot or not sleep. What you have to do is monitor urine output and activity when the baby is awake. If the urine output is good, it is alright. It will take a while and it will resolve. How do we manage these side effects? Firstly, you can apply ice pack intermittently over the vaccination area. For fever or pain, you can give paracetamol or ibuprofen as prescribed by your doctor and give more comfort and cuddles to your baby. That's what will reduce the pain. What is herd immunity? Herd immunity is when a high percentage, usually 90% or more of a population is vaccinated against a contagious disease. These vaccinated individuals act as buffer, preventing the disease spreading easily from one person to the other. Herd immunity protects those who cannot be vaccinated, like newborns or the people with weakened immune system. Vaccination is a collective responsibility. Choosing not to vaccinate can put other people into risk. Next, keeping a track of vaccination record. Why is it important to maintain an accurate vaccination record? Vaccination records are essential for tracking which vaccines a child has received and when is the next dose due. They are necessary for school enrollment, travel, and various other situations. Where can you get these vaccination records? You can take it from your pediatrician or digital health record if available at your place. What is catch-up vaccination? So these are the schedules which are available to help children who have missed a few vaccines to get back on the track. So it varies as per the vaccine and child's age. So if you have missed a dose of one vaccine, please consult your doctor immediately and get the catch-up vaccination done.